Good morning, everyone, and welcome to the inaugural meeting, if you will, of the Health Committee for 2024. Very pleased to be returning to the chair once again, and in fact, we had a very dynamic group on our committee in 2023, and very pleased to have everyone back again this morning. Excuse me, just bear with me. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we are meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We're extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have been careful stewards of this land for millennia. With that, Ms. Johnson, has the roll been called, please?
Thank you, Chair. Roll has been taken, and we have quorum.
We have quorum. Outstanding. First meeting of the year, setting the right tone. I would invite disclosure of pecuniary interest, and if any, the general nature thereof, please. I recognize none. I would seek now a motion to adopt the minutes of the meeting held on November 15th, 2023. Moved by Councillor Weir, seconded by Councillor Wilmer. Any errors or omissions? Seeing none, all in favor? That is carried. Just before I move on to the Administration Department report, I do note that we are joined this morning via Zoom by Councillor Grills, I see on the back wall, and in fact, right here on my screen as well. Good morning, Councillor Grills, and welcome. I will question, do you anticipate having your camera off just for when I call the votes? If I can invite you at that point at least to have your camera on.
Thank you, Chair. I just want to let you know that the connectivity is pretty dodgy, but I'll do my best.
Thank you very much. That is all that I can ask of you. With that, then, I'm going to turn the floor over to, I'll probably just maybe sing a song or something. Just poor timing. Mr. Kelly, the floor is yours. Take us through the Administration Department report, please.
Thank you, Chair, and good morning. The Administration report starts on page 6 of your committee package. And item number 1 is a bylaw, and I'll read the recommendation, Chair, if that's okay to get it on the floor.
Please do.
That the Health Committee recommends County Council adopt a bylaw authorizing the Warden and Chief Administrative Officer Clerk to sign the 2023-2024 Virtual Care Program's online appointment booking agreement with Ontario Health.
Thank you. I would seek a mover, please. Councillor Murphy, seconded by Councillor Purcell. Back to you, Mr. Kelly.
Thank you, Chair, and to you and to committee. So, as committee should be aware and is aware, the Ottawa Valley Ontario Health Team is, let me back up. The County of Renfrew is the transfer payment, we hold the transfer payment agreement with Ontario Health on behalf of Ottawa Valley Ontario Health Team. So as such, the County of Renfrew is responsible for signing many agreements on behalf of the team, and these don't come at a cost to the County of Renfrew. They are a flow-through from Ontario Health through the OVHT. So that will be, keep that in mind for when I talk about number 2. So item number 1, however, the OVOHT and its partners have developed a new program called the Online Booking, Online Appointment Booking Project, which will, on behalf of their partners, will simplify online booking through a series of software programs and utilizing all the hospitals and the physicians that are a part of the OVOHT. So again, this agreement signs into place with Ontario Health and shall move this forward.
Thank you very much. Committee, any questions, comments? Warden Emo, please.
Just a little curious, is there any future issues for us in terms of them trying to monetize it? Health teams are kind of the children of hospitals, and hospitals love to monetize things when they have partners. Or is there any risk to us in the future?
Mr. Kelly, please.
Yes, through you, Chair, to the Warden. Not that I've seen. So the County of Renfrew sits on the steering committee, and members of county staff, Mr. Blackmore and Chief Nolan, sit on a number of, I'll say, controlling committees that can monitor this as we go. So I haven't heard that or seen that yet, so we will monitor that as it goes, and we'll report back or have the OVHT report back if that is the case. So I'll note your comment about being children of the hospitals. In our case, I would say the OVHT is a child of the County of Renfrew because we are the TPA holders. So, thank you.
Follow-up, Warden, email, please.
And again, if I might, so is there any staffing from the hospitals into this? Because again, whenever they run into a staffing crisis, they tend to pull everybody back to their bricks and mortar, and it's hard to get them to remain committed in the community. So I'm just curious about that as well.
Mr. Kelly.
Mr. Chair, I'll have to report back on that. In particular, I'm not sure what the staffing model is. I'll have to, I'll report back on that. Thank you.
Thank you.
Thank you. Any further questions or comments? Seeing none, I will call the question. All in favor? That is carried. Thank you so much. And back to you for item number 2, Mr. Kelly.
Thank you, Chair. So item number 2 is pre-authorization for these agreements. And again, since it's a bylaw, I'll read the recommendation to get it on the floor. Is that the Health Committee recommends County Council adopt a bylaw authorizing the Warden and Chief Administrative Officer Clerk to sign all agreements with respect to programs being delivered by the Ottawa Valley Ontario Health Team, OVOHT, where agreements are necessary with funding agencies including, but not limited to, the province, Ontario Health, etc., provided sufficient funds are in place with the OVOHT.
Thank you. Once again, I will invite a motion, please. Councillor Purcell, seconded by Councillor Grills. Once again, back to you for background, Mr. Kelly.
Thank you. So once again, the OVHT is existing as I may have mentioned earlier, a pseudo-child, a stepchild of the County of Renfrew because we are the TPA holder. However, they operate with a separate and distinct board of advisors made up of folks from the industry and manned or chaired at least by, sorry, inappropriate wording, chaired by Joanne King and has a vice chair and a committee of folks in the steering committee. On a regular occasion, the OVHT gets funding letters and funding announcements from Ontario Health that require us to respond fairly quickly and, again, have no direct levy requirements or budget implications to the County of Renfrew. So what this recommendation is seeking is that with proper documentation and proper background to myself and the Warden, that we would basically have delegated authority to sign these agreements to move them forward without having coming back to this committee and council, so they are forwarded in a timely fashion.
Thank you. Committee, once again, any questions or comments? I see none. All in favor? That is carried. Thank you.
And that is the end of my report, sir.
Thank you very much. Very efficient, Mr. Kelly. We will keep on that as the theme for this morning. Just for committee's edification, as in past years, please once again that the Warden has seen fit to appoint me as chair/tyrant of the Health Committee. So by my dictate, we will be suspending within the EMS. My intent is to approach the budget as a singular item, beginning with EMS and then moving on to long-term care. So we will go through the EMS information items, resolutions, then we will hold in abeyance the budget, and then we will proceed with the long-term care reporting likewise, so that we will approach the budget as a unified, but beginning with EMS. With that, sorry, Mr. Kelly?
If I could just get a motion to report to...
Oh, your report,
thank you.
yes. I would seek a motion to accept the administration report, please. Councillor Murphy, seconded by Councillor Weir. All in favor? That is carried. Chief Nolan, the floor is yours.
Great, thank you, Mr. Chair, and it's my pleasure to provide this morning's Health Committee report. If I could, at the outset, Mr. Chair, welcome Stephanie Rose, the Acting Commander of our Community Paramedic Program, and Carolyn McGrath, who's commander, but is acting in the role of administrative commander based on a recent vacancy that we've had. And neither of them have spent a lot of time with us here in these chambers. So just a big thank you to them for all the work they do. You tend not to see them because they used to work 24 hours a day, 7 days a week on a rotating clock and not be a part of the administrative group. But we're really, really happy to have them stepping into these pivotal roles for us this morning. So, item number 1. County of Renfrew Paramedic Service Community Programs. The first item of business is related to the Education Day with Dr. Christian Davis. And as a reminder, Dr. Davis is the medical director for our community paramedic programs and is invaluable in terms of being able to provide a backstop, if you will, for many of the patients that are unattached in Renfrew County. So he supports the work of the community paramedic program, as do many of the physicians related to VTAC and so on. But to have a named physician for the purpose of delegation of medical acts, Dr. Davis not only provides those functions, but also spends time with the community paramedics and provides education, as we see in today's report. Item number 2 is related to a skin tear program, and this is an initiative that's quite novel to Renfrew County, providing training to our staff to be able to keep people at home, provide wound care, and reduce the need for emergency room visits. And this initiative was born out of our own staff, identifying that an extraordinary number of people were required to go to the emergency department for this level of care, and we're very pleased to be able to provide it through our programs here in Renfrew County. The third item within number 1 is refining the referral process, so not dissimilar to the information that Mr. Kelly provided from Ontario Health, and getting people access to their records. This is an opportunity for us to continue to work with the population that we have, and also adopt this technology by Ontario Health teams in the region, and to do that in a way that aligns with our local primary care, but also our existing processes within the business unit of community paramedicine. Related to pre-HOS, and that's one of our software providers, we continue to work with them in terms of providing information, but of equal importance is the ability to get valuable information out of that database. So as we are reviewing our electronic medical records as a service, we are looking to homogenize that process, and this is a critical step towards that in terms of being able to get live patient status data, which allows us to be able to provide just-in-time interventions for our patients, but also look at the service from a systems perspective. Champlain Regional Stroke Network, and this is really focused around our commitment to expanding programs such as the TIA or mini stroke program, and trying to reach out to larger groups and also individuals in need of this type of training, those with pre-existing hypertension, for example, are at a greater risk for stroke and TIA. When we look at VTAC, I think it's no surprise that December, with flu, with RSV, with increases in COVID rates, we have had a bit of a surge, a seasonal surge, I would put to you, related to medical reception, virtual visits booked with the physicians, and the visits booked with paramedics at clinical assessment centers across the county. And of course, the community paramedics continue to provide home visits for those that are unable to get out to our clinics. And as a reminder, we have clinics operating in Arnprior, in Renfrew, and in Pembroke principally, but as you'll see in the next item on today's agenda, we are also providing paramedic health reviews and expanding that program into Barry's Bay in collaboration with the Madawaska Valley Health Team. So very pleased that they've done 41 paramedic-led health reviews since the start of the program, and that's something that we're going to continue to flourish, because that's our opportunity to take a very prevention-focused lens to ensure that people living with comorbidities or the likelihood of being able to catch high blood pressure, for example, can have significant downstream impacts in reducing the risk of stroke and risk of cardiovascular disease and so on. And then lastly, Mr. Chair, item number 2 related to emergency management compliance, and we have submitted to the province in full completion of our requirements under law and we wait to hear back from the province for our certificate of completion. So I'll leave it with you there, sir.
Thank you very much. And I would invite committee, we will go back to information item number 1. And I will work my way through any of the components individually. Education Day with Dr. Christian Davis. Questions, comments? The Skin Tear Program. The refining referral process. Enhancements to pre-HOS database. The Champlain Regional Stroke Network. VTAC. And finally, the Focused Paramedic Review Program. Moving on to item 2, the Emergency Management Compliance. Questions, comments? I see none. The floor is yours once again, Chief Nolan.
Thank you, Mr. Chair. It's my understanding that we'll be holding off the resolutions.
That is correct. That is the singular resolution, so we will hold that in abeyance. Thank you that we are holding this in abeyance. I'm presuming, Mr. Kelly, we are not seeking a motion to accept the report at this time.
You are absolutely correct, sir.
Thank you. Once in a while, that does happen. Mr. Blackmore, then, if I could prevail upon you to take us through the long-term care report.
Thank you, Chair Donahue. Through you to committee, I'd like to welcome Dean Quaid, riding shotgun with me today, Administrator of Bonnechere Manor. Your report starts on page 42. Number 1 confirms the compliance with the annual attestation requirement for the County of Renfrew long-term care home administrators, attesting that each home's completed their emergency plans, which constitutes a number of emergency plans and exercises to be completed on an annual basis. Item number 2 denotes the respite program status for each of Bonnechere Manor and Miramichi Lodge. Annual application for 2 respite beds was approved for Miramichi Lodge. Given the ongoing staffing challenges at Bonnechere Manor, with the deadline ending in December, it was decided not to extend respite stay beds at Bonnechere Manor, largely due to the contingency of staffing agency staff employed at the manor at present time. Respite services are heavy on admissions and discharges, which tend to be some of the more high-risk times and needing the most time afforded by our professional RN and RPN staff. So this is something we'll revisit, hopefully, in the new year when our staffing situation stabilizes such that we have more permanent staff in place at the manor. Through to committee, item number 3 details the public health inspection conducted on Saturday, December 9th by Inspector Ola Ostafchuk. 2 areas of non-compliance were identified regarding shelving and ceiling tiles, and committee will recall that these items were raised once before in the previous report with a deadline of April 2024 to come back into compliance. It involves replacement of some cupboards and ceiling tiles, for which you'll see later on in the report we weren't able to go ahead with the project we were hoped to have completed by the end of the year due to the back order of some materials. Item number 4 denotes public health inspection conducted on December 20th by Inspector Shannon Thorpe, with 2 items that were identified and corrected at the time of observation. It basically resulted in a 100% inspection compliance. Item number 5 summarizes the Ministry of Long-Term Care inspection conducted in September 2023 by 2 inspectors over a period of 8 days at Miramichi Lodge. Upon completion, 3 written notifications were issued concerning delayed reporting of an allegation of physical abuse. Homes are required to report immediately. There was a delay in staff notifying management of a staff member observed not wearing full complement of personal protective equipment, and there was an issue of an office door being left unlocked. And I'll add that since the time of this report, there have been 2 additional multi-day inspections at each of our homes, for which I'm not able to report on yet until those reports become public, but I expect they'll be in the February report. I'm thinking this may be an indication of what is now, with the recent hiring of inspectors, we now have 1 inspector for every 2 homes in the province. And sorry.
If that completes the information items,
Sorry, just if I could.
sorry, please do continue.
Just wanted to reiterate the announcement recently made by the Ministry of Long-Term Care. Minister Cho announced the government's new 10-person long-term care investigations unit that is already actively working in our sector. This unit investigates offenses under the Fixing Long-Term Care Act set out in legislation such as failing to protect a resident from abuse and neglect, repeated and ongoing non-compliance, failing to comply with ministry inspection orders, suppressing and/or falsifying mandatory reports, and negligence of corporate directors. The province has invested $72.3 million to support this unit, and the investigators are designated as provincial offences officers under the Provincial Offences Act. The media release noted that while inspectors identify and address noncompliance under the Act, investigators determine if there are grounds that an offence under the Act has been committed, which could, if prosecuted, could result in fines and/or imprisonment. Advantage Ontario, our advocate for not-for-profits and municipal homes, recently commented on this situation, identifying that while enforcement is helpful and necessary, the corollary is that we need more funding to enable quality care. A narrative has emerged that more inspections and now highlighted vigilance with investigators and imprisonment tools would have improved outcomes during COVID. Advantage's perspective is that this is not true. We need more staff and more funding to pay for these staff. Unlike emergency rooms, long-term care homes cannot close, and as a result, homes have lots of temporary staff who cannot provide the quality of care needed, nor can they possibly know all these rules under the Fixing Long-Term Care Act. Measures such as increasing inspections and hiring investigators will actually result in more staff leaving and/or not entering the system, which will exacerbate the issue. Again, Advantage stresses that they believe the best way to protect resident safety and quality of care is through increased investment in long-term care health human resources in addressing the temporary staffing agency issue. Anyhow, just maybe you've heard, I'm sure it's throughout the news now, just again indicating that there's certainly an emphasis on the inspection end of things, for which I expect we're going to see more and more of these inspections appear in our monthly reports.
Thank you very much, Mr. Blackmore. With that, I would invite committee to go back to information item number 1, the emergency plans attestation form. Questions, comments? Item number 2, the short stay respite care bed application. Item 3, Renfrew County and District Health Unit inspection report at the Manor. Item number 4, the Health Unit inspection report at the Lodge. And finally, the Ministry of Long-Term Care inspection report at Miramichi Lodge. I'm seeing none. With that, then, Mr. Blackmore, I would invite, there is a resolution that does precede the budget, and again, this is picking up on one of the, item number 3, in fact, that Mr. Blackmore was making reference to at Bonnechere Manor. So I would invite you to take us through resolution. Item number 6, please.
Thank you, Chair. Through to committee. A recommendation that the Health Committee recommend the County Council approve $25,000 carry forward from the Bonnechere Manor 2023 capital budget to the Bonnechere Manor 2024 capital budget to accommodate the cabinet renovation project, and further, that the Finance and Administration Committee be so advised.
Thank you. Can I have a mover, please? Councillor Wilmer, seconded by Councillor Weir. Back to you, Mr. Blackmore.
And background, as I alluded to earlier, this generates from an inspection report. The cabinet replacement project for Bonnechere Manor serveries was scheduled to start December 2023. However, due to supply back orders, this project was delayed. We are requesting approval to carry forward $25,000 in the Bonnechere Manor 2023 capital budget to the 2024 capital budget.
Thank you. Committee, once again, any questions or comments on the resolution before us? I see none. All in favor? That is carried. Thank you. And as we are now at the long-term care budget, we are going to reverse once again. And I will invite committee back on page 30 is the resolution with respect to the emergency services budget. So I will begin, Chief Nolan, if you would be so kind as to read the recommendation. I will get a mover and a seconder, and then we will take it through the presentation.
Thank you, Mr. Chair. That recommendation that Health Committee recommend the draft 2024 emergency services budget and business cases be forwarded to the January 24th budget workshop as presented.
Thank you. Could I have a mover, please? Moved by Councillor Wilmer, seconded by Councillor Purcell. Now, as I understand, there is a PowerPoint presentation. The budget also for Council's consideration begins on page 65 of the PDF. And with that, Chief, the floor is yours.
Thank you, Mr. Chair. Just pulling up the presentation here on Zoom.
That was, by the way, I believe, distributed to all of committee, if you wish to bring it on your own screens as well.
Thank you, Mr. Chair. At this point, I believe I hand it over to Mr. Kelly for introductory remarks.
Thank you, Chair, and thank you once again. So, again, thanks to all the directors and managers, and of course, administrative assistants and Mr. Burke for putting together today's budget presentation. So, as you may have heard me yesterday in committees, these documents have evolved over the years, and this process certainly has, and we are open to criticism and critique of today's presentations as we move into next year's budget. But in any case, as we launch our presentations, we recognize that budgeting is indeed about making choices. And when we set out last fall to start building our budgets, we determined very quickly that meeting your expected targets would be a very hard task. Several decisions were made during the 2023 budget process that would have mid-year or everlasting implications. We also began to realize very quickly that the costs of doing business had increased beyond the targeted levy increase, and the pressures of presenting an apples-to-apples operational budget became increasingly apparent and mostly unachievable. However, gladly, what is being presented today and throughout the week is staff's best efforts to continue providing the equivalent level of service that we and the ratepayers have been accustomed to, and we've applied the pressures of the financial realities of today. You will also be presented with a number of new enhancements to our operations based on strategic initiatives that have been suggested leading up to these meetings or in response to our operational needs given our circumstances in some of our divisions being discussed this morning. But again, budgets are about making choices, and as we head towards the budget workshop, you will be presented with these choices, some admittedly easier than others, and that will need to be made in order to achieve your target goals. But I will, Mr. Chair, if you're okay, I'll ask Mr. Burke to walk through the process today that we'll be discussing.
Thank you very much, Mr. Kelly. Absolutely, Mr. Burke. The floor is now yours.
Thank you, Chair, and good morning, committee. Before I turn this presentation over to Director Nolan, just take a few minutes and walk you through the format of your 2024 budget. So on the slide in front of you now, you have our budget guidelines. That first resolution being our target for the 2024 budget, a 3% annual levy increase. The second resolution concerns the non-union salary estimates that are built into your budget. If you follow the resolution and the math inside that resolution, that number is a 4.79% increase over the 2023 year. Where we have union contracts, we have used that number. Where we have expired union contracts, we have made an estimate. The third resolution on your screen concerns a carry forward from our November the 9th special council meeting regarding our long-term financial plan and asset management plan. And we have built those, the request of that meeting was to meet in the middle and reduce our capital asset management plan by a bit and increase our reserve funding by a bit. So we have built this budget with that in mind, trying to comply with that. If I could get the next slide as well. So when you're looking at your budget document, we're frozen. Anyways, if you're looking at your budget document in the package, you'll notice that each page begins with a number of columns, and on the right side of your page, you have 5 columns of actual data from 2018 to 2022 historical financial data. Moving towards the left side of your page, the next 3 columns involve variances, percentage variances, either in absolute dollars or in percentages. And the next column to the left is your baseline budget, that blue column. And what that's trying to say is, what would it take to do exactly what we're doing right now for the 2024 year? Moving towards the left, then you have a pressures column, and that's what staff's best I'll say proposal for what we could not do in order to meet the 3% target. The next column to the left is your budget that it meets the 3% target, so it incorporates that baseline budget plus the suggestions in that pressures column budget. And the furthest column to the left, your 2024 budget enhancements. These are new or enhanced levels of service that County Council might consider providing in the 2024 year. And if I could get the next slide. New to the 2024 budget, something we didn't do last year, we have ranked our pressures or our suggested service level reductions as level 1, level 2, or level 3. So level 1 items are those pressures that we can easily achieve and that have a minimal service level disruption. Level 2 items, those things we'll color orange, are items that we can achieve and that have a minimal service level disruption, but they're really temporary solutions. So either getting someone else to pay for it or shifting costs into a future year, things like that, sort of a temporary solution. The level 3 items, those items we have colored red, are items that are major service level reductions, and that will be hard choices to make. And if I could get the next slide. The last point I'd like to make before turning it over to Chief Nolan is about achieving that 3% target. So you'll notice that in Health Committee, even after we account for the budget pressures, the variance is still greater than 3%. So the approach we took in the 2024 budget was a global approach. Rather than in isolation for each committee to meet a 3% target, we step back and look at the County of Renfrew as a whole. Where can we make those reductions that make the most sense? So while Health Committee individually might not meet the 3% target, the county as a whole does if you accept all of those pressures reductions. And with that, I turn it over to Chief Nolan.
Actually, just one question, and then I will invite Chief Nolan on the presentation. Probably for you, Mr. Burke, but I will leave it open. So when we are looking at this, what is on the screen now vis-a-vis the Health Committee, as part of our long-term financial plan, we have the scorecard, and one of those items is on the operating increases. So when we are looking at this, particularly at the column, the most extreme right-hand column that does give the variance on the 3%, and ultimately across this committee it is showing it as being 9.5, even adjusting for those pressure items. So is that in fact the operating increase that we are looking at, or is being proposed as it would pertain to that long-term financial plan target?
Thank you, Chair. That is correct in that, so that far right column on your screen, the variance that meets the 3% target involves the Health Committee increasing by 9.5%, But the total levy change, if we total up all the other committees, is only 3%. So what that tells you is that when we step back and look at the corporation as a whole, Health Committee was not the area where we were able to drive the most savings. We had to look at other committees to do that.
Thank you, and that does clarify. And just to put perhaps a fine point on it, in fact, as a component of the long-term financial plan was that operating increases be maintained at 2.5%, ideally 2%, but with an outer limit of 2.5%, which ultimately signified that of the target 3, there would be some funds in addition to the real growth funds that would also be taxed with an intent that they be rolled into the capital reserves. So in this instance, even at an operating increase of 3, it leaves nothing remaining to roll into the capital. And I do understand that when Mr. Burke is referring to the global, that is enterprise-wide across the county of Renfrew, and I much appreciate that clarity. I don't know, Councillor Murphy, did you wish to add some clarity as well?
Thank you, Mr. Chair, and I know that we're third in line of committees this week, but that's a good note for this afternoon's committee, and then, of course, for F&A tomorrow. The warden and I had the opportunity to go through this in December as a whole, but now we're looking at it in silos. So Daniel is absolutely correct, and your question is so germane, because this was not the committee where we felt that there would ever be savings, knowing the wish of all of County Council and the enhanced services that we wanted. So yeah, that's a great point, and probably should have mentioned that in December, that you should tell every committee. You'll see all the County Council faculties add budget, but thank you.
Thank you. And I would not close the door on potentially at some budget, be it this one or a future budget, that we might find some savings within Health Committee. We are always striving for the same. With that, Chief Nolan, the floor is yours.
Yeah, thank you, Mr. Chair, and thank you to Mr. Kelly, Mr. Burke, for getting us to this point in the presentation. There seems to be a bit of a technical lag in my screen, so I'm just going to have to go back through this process once again of stop screen sharing and starting over again. So if you could give me one moment, Mr. Chair.
I believe we have a moment, Chief.
Thank you, sir. All right. And is that sharing? Nope. Good. All right. Thank you, Mr. Chair. So in terms of the overview of today's paramedic service budget specifically, I put before you some numbers that I think fundamentally reflect our effort to work towards the target that's been provided, but also a couple of pressures within the budget, some small, some significant. However, there is no new concepts in today's budget for you. A couple of our significant drivers of cost within today's paramedic service budget, and those can be found specifically as it relates to salaries and benefits for paramedics based upon percentage of increase, representing over 80% of the paramedic service budget. And then also, as you'll recall, the commitment by council to add 24 hours of paramedic availability to be able to mitigate a number of the pressures that we've previously discussed. So without belaboring those pressures, I'm happy to say that we now have 6 months of experience in that model of adding 2 12-hour vehicles, or one, the equivalent of 24 hours of enhancement coming out of last year's process. We did realize 6 months worth of expense as it relates to that program, but that commitment was for 24 hours of paramedic service spread out throughout the entire year. So there is an additional pressure within my budget this year that pertains to the balance of that commitment, which is we only picked up half of it. We were only able to draw the province into a certain proportion given the rolling nature of provincial funding, and that there's always a catch-up year that is required when new expenditures beyond the previous year's budgeted amount will be realized. So that is why there is a bump this year in the second 6-month period, whereby we've only been able to draw the province into their roughly 50% share of 50% of that cost, now realizing that as we budget for this year, there will be a catch-up year next year, and then it will equalize out to being roughly 50% provincial cost, and then a share between county, the city of Pembroke, and the Algonquins, Pequawkin as a funding contributor to the budget as well. So when we look at the slide that's before you, knowing that that's the overall context, the recovery and cross-border donations and other agency costs are really are pretty straightforward, and I don't think there should be any significant surprises within this for you. There are some changes in terms of, for example, the special projects in PTSD prevention, fatigue risk management, and just a reminder that was 100% federal dollars flowed through the county with our partners at Conestoga College and the Canadian Standards Association to be able to better inform practices across Canada in the management of PTSD prevention and fatigue risk management. So you see some of those programs have come to completion. In other circumstances, we have the transfers to reserves, capital, depreciation, and transfer from reserves, and those numbers coming and going. There have been a couple of changes within that bundle. One is that the vehicle manufacturers now require a down payment of $100,000 per vehicle hopefully the year prior to us receiving the vehicle. So the typical way was that we would order a vehicle, and then when we receive that vehicle, we would pay for the whole thing. Now we have to put $100,000 up front when we order to get in line to then be able to receive the vehicle likely the following year because of the supply chain issues that we're all experiencing. And so that has given us a falsely elevated cost at the outset, because now we have down payments on top of full payments for past ordered vehicles, and now we have down payments going forward, which of course reduces, by a commensurate amount when we do finally pay for the vehicle, because it's netted off of the original order. However, it does show as an anomaly within our transfers to reserves and the way that we are paying for things, which is different because historically we've only ever paid for something once we've received it, and now as was addressed at previous committees and councils when the manufacturers came forward, that this is now the new norm. This is not just us, this is for all customers that purchase ambulances from the one company that has 2 manufacturing streams in Canada. When we look at other amounts, we've been able to try and find some savings, for example, in travel. Uniform, laundry continues to be a challenge, so it's a status quo. And vehicle operation and maintenance, we have a slight decrease in that line, you'll see. However, with fuel costs such as they are and conflicts around the world that tend to drive oil and gas pricing, we'll continue to monitor that closely. We have also looked at electric vehicles and the availability, but the suitability for that in the rural environment and the number of kilometers that we put on, it is prohibitive at this time, Mr. Chair. The next slide, as it relates to the 911 program specifically, there are not changes in terms of the administrative wages directly. However, indirectly, there were some unintended consequences of previous evaluation of positions and reevaluation of positions, and there are 2 business cases within my report that do speak to this on pages 17 and 18 within the report, and that is about addressing the compression-related issues caused between the frontline commanders and the deputy chiefs, as well as the administrative commander who was originally identified as being 35 hours a week. Now that we have a few years of experience under our belt in that position, it was recommended that we move the deputy chiefs from 35 hours a week to 42 hours a week to be consistent with the operational staff within the department, both the commanders and the frontline staff, which then reduces the amount of compression between the positions. And, said in very plain language, the hourly rate is one thing, but when you make an hourly rate and you're working on average 7 hours more per week than your comparison group, that's what then drives you into the next level, which results in the commanders making more money annually than the deputies that they're reporting to. So that is reflected within the report, as is the workload as it pertains to the administrative commander, and a realization or an acknowledgement that that position requires more than 35 hours a week, and also flexes their schedule to match operational requirements. So in some circumstances begins early, other circumstances stays late, and in many circumstances is doing both, and resulting in a 12-hour day. So that's just our operational reality. There is a financial consequence on pages 17 and 18 within your report. There is a slight adjustment in the hours and the total budget change. So the budget numbers that are presented to you in today's budget are the accurate ones. So we're going with the pump, not what the cash is telling us on this one. So in that circumstance, it brings it from the 116,914 down to 115,328. And that will be revised in future versions of today's report. And commensurately, the hours go from 260 to 364 to recognize the 42 hours. So we've also changed the language slightly in that we've only ever had summer students. However, co-op students, I think, more reflective of both university level help to be able to support much of our data management issues, and as well working on some AI and machine learning components to those roles. And it also takes us out of the traditional summer month period that we've hired staff in the past. When we look at the paramedic wages overall, each of those wages are broken down by staff, hours a day, days a year, and then the totals. So if you're in Renfrew, for example, you'd say, hey, wait, I have 2 vehicles running out of there. True, but it's broken down in terms of the base rotating 24/7, and then this notion of upstaff really isn't an upstaff so much as to say it's the day vehicle or the evening vehicle or by base, and there's a fluidity to that. The one that I think is critically important for you to understand as it relates to mobile response. So you'll recall that Council originally directed that we would have first response capability that was introduced as the original community paramedics within the county who provide first response capability. This also provides us some policy cover with the province so that those that are receiving 100% funding for community paramedic activities, this is the county contribution that allows us the ability for them to 911 respond across the board. It's critically important in terms of the services that we provide, because we treat those paramedics and the ministry 100% funded community paramedics all the same. You would know no difference with the response, but it does give us the latitude to be able to have our community paramedics fully responsive. And that's especially important in the rural parts of the county because they are often first responding, first on scene, and a support to the 911 responding paramedics. And that has been, I'd say, one of the very important parts of the program as we have it designed. You'll also see this come up again in terms of proposed cuts and the slide that we talk about there. So I just want to anchor it here for you so that you understand where they fit within this overall matrix. They are, of course, 50-50 funded as well, and then the Pembroke portion contributing to that. So when we look at the overall issues related to paramedic hours and the 175,200, we are looking at the QP agreement, and so we have projected costs, as Daniel said, within this budget to be able to hopefully move us forward with our partners at QP, but we are currently in bargaining with QP. So there are some hypotheticals here in terms of where we land in terms of our salary and benefit cost. However, we believe that what we've put in the budget should reflect a contemporary view of compensation for our partners at QP, and we'll see how that conversation unrolls. The 7,000 hours and shift overrun and overtime is estimated, and I would say that it's estimated in two ways. It's estimated based upon those factors that contribute to shift overrun, such as hospital offload delay, late transfers to the city, as well as 911 responses. However, I am happy to say that the ministry has welcomed us into the Central Ambulance Communications Center so that we can have a commander in CAC to be able to directly affect issues that have a cost, such as end of shift overtime, as well as our meal break and lunch period related costs and workload distribution. So I'm hoping that that estimation is actually on the high side, but it is based upon last year's experience with a on-again, off-again commander working in the communication center, which has been, I would say, a success. Now we need to put more emphasis there to be able to do both cost mitigation, but also be able to exercise the opportunities within our deployment plan as the ministry is rolling out the new medical priority dispatch system, which council needs to be congratulated for, because that's been an ask of ours for some time in terms of the modernization of dispatch in Ontario. And we are the third or fourth dispatch center to be rolling out amongst many, many across the province. So very pleased with that, and the commander in CAC is an essential part of that both operational and culture shift that we require. There is 19,000 new offload funding hours that we were successful in our application to the province, and we are working with our partners at Pembroke Regional Hospital, and the Renfrew Victoria Hospital is also eligible for this funding based upon our collaborative application. That is 100% dollars once again, and if you think of the factors associated with offload delay and transfer of care, this is a significant opportunity for us to continue the very good working relationship we have with the Pembroke Regional Hospital by having our staff working in the hospital on a regular basis. On the next slide, looking at capital purchases, really there's very little that's new here in the vehicle side of the house, and these are market value pricing that are based upon our capital plan. So as I said earlier, there's a deposit requirement, which is a $400,000 driver for something that we won't receive this year, but intend to receive in subsequent years. The defibrillator costs here, we've been working with significantly old, this is the defibrillators that the paramedics use, not the one hanging on the wall at the rink, and there is a significant cost per defibrillator. We've been working with one of our vendors to understand what the financing options are, and there is a lease option that we've worked with our finance department on, and so that is showing within our budget overall. But that is really a comprehensive 10-year plan that gives us a full renewal of the entire fleet of defibrillators at the 5-year mark, which we've been milking for many years, the existing devices that we've had, and they are beyond legacy at this point. And there has been some historic costs in terms of some of the maintenance of those devices and replacement of parts and things. So while this is a total new cost in the way that it's being presented in today's budget, it is essential from a capital and operating perspective, but we are moving this from capital to operating by doing it through a lease and hoping that we can smooth out those costs on a go-forward basis and not have a significant bump every 5 years in terms of those costs. As well, we have 2 emergency room staffing agreements currently that are reflected here. The offload delay funding is not insignificant. It's $840,000 based upon what we were able to achieve with the province. And there's an interest allocation requirement under MOH guidelines, and that sits at $75,000. And of course, these programs and funding are cost shared with the city of Pembroke based upon population. So when I talk about 50-50, it's It's kind of not. It's about 1% Algonquin. Daniel, correct me here if I'm wrong, but the City of Pembroke share sits at about 14 or 15%. And then, so it's about 35 cents on the dollar from the County of Renfrew for anything that is a 50-50 cost allocation. When we look at the Paramedic Service 911 program, overall, you can see here from 24 to 25 in terms of the municipal budgets, transfers to reserve, principal repayments, and at the very bottom there, I'll point you towards the First Nations funding as well, and I believe that's a capitated rate as well. When we then go to the colorimetric slide here, there are a number of things to be contemplated. So for us to be able to move from our existing budget towards the 3% target, there is an opportunity to remove 3 full-time non-union logistics positions. We created these positions to be able to move people from WSIB, which are 100% of their standard cost plus an administrative fee, to WSIB, into positions that have greater security within them and greater consistency within them, but don't necessarily, or don't rub up against any functional requirements for the reasons that they're on WSIB to begin with. So we have created 5 of these positions. We've exercised 2 of the 5 positions, and there are 3 that remain vacant. So an opportunity to simply back those pressures out of our budget towards the 3%. With the opportunity of being able to realize almost $200,000 in, I'll put air quotes around savings, but that's really the opportunity as it exists. If we do have people with functional requirements that do meet future logistic related positions, then I guess the opportunity is to come back to say, based upon the original logic, which is if we're paying about 120 to 130% of your salary costs by paying WSIB an overhead to manage your claim, when you're now in a kind of stable state, the opportunity is to reduce or eliminate those WSIB costs by putting you in a position within the department. And that's the logic that predates some of the people sitting in chambers here today. That in red, we're looking at reduction to reach levy by really bumping up against 2 significant related issues. One is the reduction of 25,500 paramedic hours based upon the 2023 upstaff. So that 2023 upstaff is essentially saying that we would be incomplete in the commitment that we made to add the 24 hours of paramedic service for the pressures and reasons that we've previously discussed in these chambers. So essentially reduce our commitment to 911 paramedic response by not fulfilling the original upstaff obligations. And then secondly, the mobile response that I talked to you about previously, whereby we have 50-50 first response capability of single response paramedics, would be to eliminate those hours as well. So it's reducing the 911 availability by not completing our commitment to the enhancement that was approved by council last year, and then also reducing our commitment to the emergency response capability of the community paramedic program based upon these amounts less the City of Pembroke share. And then lastly, there is an enhancement that I've already covered off for you on 17 and 18 as it pertains to the compression issues related to the deputy chiefs and the admin commander hours of work from 1820 to 2184 per year per position, which aligns it with the balance of our operating hours within the service. Which would then leave myself as the only 35-hour worker within the service, save and except the office administrative staff. When we look at the community paramedic and long-term care program, Mayor Murphy, we're looking at the salary and benefit related costs. So there are a couple of issues here that have resulted in another green for you, and that is that while we received 100% funding, in the first year from the province has not put an escalation clause related to that amount, so it's remained steady. The good news is they've committed to longer periods of time, but they haven't put an increase to that program. And as you know, with cost of living and other related drivers, that then puts a pressure back in the program in subsequent years, in that the service level that we were able to provide the first year then becomes eroded because we don't have a corresponding increase in the province. So what we identified as a pressure related to predominantly collective agreement related increases then puts a pressure back on the equivalent of 250 paramedic hours within the program, resulting in about an $18,000, call it opportunity, if you will, towards the 3% goal. Health Committee and Virtual Triage and Assessment Center, not dissimilar in that we don't have an automatic riser within that program. However, being still in its relative infancy, and we're very pleased that the province has committed to the long-term funding of this program, we do still believe that there are some vulnerabilities as it relates to the year-over-year funding from the province. So when we look at that, and in the previous conversations in org chart, we have 7 full-time non-union staff, 6 part-time non-union staff, about 14,000 paramedic hours within this program area. And then we have internal rent related to Arnprior, Renfrew, and Pembroke currently. We have previously had a Cobden rent, which we've recently discontinued. However, there may be some new opportunities with new base renovations occurring throughout the county. And the provincial, just as a reminder, the provincial funding agreement is annualized, and we'd like to see a longer horizon. So this, I'm sure, will be one of the topics of conversation that you can help us with at Roma this week, that the program has been overwhelmingly successful for not only the 30,000 people who don't have a family physician in Renfrew County, but also for the balance of people who have chosen to use this service with very high reviews. When we look at the emergency management budget overall, there's, as a reminder, there's an internal recovery charge for my time in this program, because this is 100% municipally funded, not 50-50 or 100% provincially funded. There's also funding related to the dispatch, and just as a reminder, since Lee is sitting to my left, I take care of the contract for the fire dispatch communication system, and he's responsible for the telephony system and the radio system, and this is a point of contention between us, but I'll leave that for another day. We also have an application in as it pertains to capital purchase for a sandbag machine, and that was the emergency management grant that you recall that we applied for late last year, and that's a sandbag machine to be shared amongst all based upon demand. And then lastly, the recoveries is a provincial grant for that, so 50% of training and 50% of the sandbag machine. So I think that's fairly well laid out for you. Pretty status quo. A reminder that both Arnprior and now Renfrew are no longer participating in the fire dispatch agreement. So there will be some toing and froing in terms of costs associated and recoveries associated with that program. But that is probably the most relevant update for you, apart from the wonderful work that Lee and his team are doing around the upgrading of the hardware related to this program. So thank you, Lee, for all the great work that you're doing and the expertise that you bring to that file. And then, Mr. Chair, I think at this point it would be apropos to hand it over to Mr. Kelly to lead us on this slide.
Mr. Kelly, take it away.
Thank you, Chair, and thank you, Chief Nolan. So if you tuned in yesterday, you saw the first blush at this. So we have been chatting strategically amongst council and staff, and you've heard several initiatives come forward from community services and DMP and of course paramedic service about issues with housing. And I'll just globally say housing and homelessness, I guess. So we have identified several issues, initiatives, and placed them into one bucket. And this slide is that one bucket. So what you heard yesterday from Mr. Davis was, and I'll point to you, Chair, to say that the other directors are in the room today to speak to their individuals should you wish to go through it. Pieces of this bucket are owned by the different committees. However, tomorrow Community Services will own all of this slide, if you will, and will seek a resolution to move this forward to the budget workshop. But this bucket talks about staffing needed to respond to our housing needs as a housing service manager. It speaks to how we address the lack of housing, perceived or otherwise, in the county of Renfrew and how to move that forward. It addresses our needs with our proposed homelessness and mental health mobile hub, and puts a number to it and just frames it all in one general conversation. Now, the intent is to chat about it during committees this week, to hear about the concepts behind it. In your margin on this slide, we have kind of throwing some spaghetti at the wall to see if it sticks, as we said yesterday, on where the money could come from to fund this. And again, going to Roma next week, in terms of what we advocate for. We are talking about the homelessness hub, of course, and looking for funds to either pilot this or move it forward. So again, this is one slide to encapsulate all things housing and homelessness that we have, again, strategically worked towards bringing you today. But perhaps, Chair, should you wish, you can ask each individual director to speak to their individual point on this and have them walk through it, but I'll leave that to you as the Chair.
Thank you very much, Mr. Kelly. I think that it is important. I think we're at a foundational stage, and because this is a collective initiative, I think that it was absolutely appropriate, as we have all three of the departments represented here in the chamber this morning. I would like to, and I think that it would be of substantial benefit to committee today to review this as well. I will leave it to you as to how the cast of characters shall unroll.
Wonderful, Chair. So perhaps because it is his portion of it, I'll ask Chief Nolan to kick it off, and then he'll point to his colleagues.
Thank you, Chief Nolan. And just before, I'm assuming, Mr. Perkins, you probably will join with me in recognizing the Chief is an expert in sandbagging. Councillor Murphy.
Sorry, just before the chief takes over, by the way, Daniel did the entire budget with Peter and I in less time it took you to do yours. Just, that bears scrutiny there. No, I think for our new...
FYI committee, Councillor Murphy is just suggesting we're a little slower.
Or more
just
thorough.
for our new members, I think it bears notice that we've never done this before. That this is a brand new, and you really do see the importance of these initiatives and how, in 2024, they're not going to get better. They're going to get worse. I don't want to be all doom and gloom, but I think that between the directors and Daniel and Craig, I think putting this chart together was a very, very, very good start for us. And taking it out of each individual budget and putting it as a totality so that we can see all the areas where we can ostensibly steal money from and try and fix some of the issues that we're realizing in the county. So I thought for our new members, you should realize we've never done this before. And even for the warden and I, when we were looking at it, it was all new and innovative, but quite scary. So thank you, Chair. Just wanted to get that out.
Thank you. And I think it underscores this is the first time. It is not going to be the last time reality in the life of those ratepayers and residents of our community don't fit neatly within the directorships and the committees that we have here. I think that this is simply groundbreaking at this point. With that, Chief Nolan.
Thank you, Mr. Chair. And I guess, in an effort to be thorough, there's an opportunity here to hear from each of the directors on this program. I think to set the stage, one of the notions, and it's not the first time we've talked about the social determinants of health in these chambers, but I think it's critically important to understand the intersection that we're talking about here. And, thanks to Mr. Kelly for bringing the three of us together to be able to solve what could be, an unsolvable issue by bringing our various lenses, but also our contribution to the problem through solutions. And I think that that's critically important. So, thank you, Mayor Murphy, for taking the 3 minutes to preface that, because that's really helpful for us to be able to understand sort of how each of us is going to come at this. And I couldn't be happier to be working with Andrea and Jason on this. So why don't I turn it over to Jason first, given that being the top of the page, and to understand in that context of the social determinants of health that housing security is fundamental to the prosperity, but also the health of our population, as is, for example, education, as is food security, and a number of the other elements within the social determinants. But having a roof over the heads of our most vulnerable people is of critical importance to be able to not only affect the health of our population, but also the security of our population going forward. So Jason, if you could go first, and then Andrea, if you could speak to your component, and then I'll wrap it up around the response teams.
So, Mr. Davis, very welcome to have you as a cameo role in the most highly rated committee broadcast within the county of Renfrew. You're most welcome. Take it away.
Thank you, Chair, and good morning, committee members. Item number 1, or the first line item, what you see there, and it was brought to D&P and through County Council, the idea of having some locations within Renfrew County to have shovel-ready projects. We do know that the province and the federal government will be spending money or sending grant money towards the municipalities for housing initiatives. And so with this line item of $150,000, what we're looking for is to have 3 or 4 locations that the county owns shovel ready for a project. So we could be looking at this location, the CAB, Renfrew County Place, the Miramichi Lodge, or Bonnetshire Manor for a housing initiative. And with this $150,000 would just be the start. We'd hire a third-party consultant to review the sites and services to move forward for possible grants. Line item number 2, and I'm going to skip down to 2, 4, 5, and 6, all deal with Renfrew County Housing Corporation assets. I won't belabor the point about our housing initiatives or current housing stock. But as a reminder, though, we do have 1,020 units that we are the landlords for. We've brought to your attention and to County Council's attention the conditions of these units. So of these 1,020 units, we have minimal staff, actually. We have 13 custodial maintenance staff, full-time staff, and 2 part-time staff. And when you look at that and you just do a basic average, 1 staff member for maintenance of these old buildings is 68 units per staff member. This was discussed before COVID. What we're talking about in line item number, I do believe 4, where Renfrew County maintenance staff to increase by 2 staff members. That's what we're looking for. We're looking for more support. You're aware we have 2 new builds. The Lee and Douglas will add additional 8 units. And then at 202 Cecil, we have a single detached to a duplex. So another additional unit that staff will have to maintain. And that's why we're looking for additional staff in that perspective. The second perspective with the additional staff is we currently have 30 to 40 vacant units because of staffing and because of contracts, but it's a cascading effect. If we could get these vacant units turned over faster, quicker, we can move people through our system, and that will help everyone from the first line staff of the paramedic service to Andrea's staff for their clients and tenants. That's why we have that synergy between the three departments. As we move forward too, we see the costs for our hoteling costs. Currently in 2023, we've spent over $230,000 in hotels. It's not directly related to our vacant units, but there is an aspect to that $230,000 plus for hotels. So we see all these numbers moving forward. So that's why we're looking for increase in staffing for the custodial and the repair people. We're also looking to change some of the classifications for the custodians and repair people. They are doing the work to increase because of the conditions of these buildings. It's not a matter of just sweeping and typical janitorial services. We're doing more to get these units ready and quicker. Secondly, we're looking at the idea of having an administrative assistant, an AA, that's line item number 4, I do believe. Currently, we share an AA with community services. We do know with our workload and with the number of contracts and the administrative uses we have for an AA, we need a dedicated full-time staff member. That's what you see in line item 4. And last but not least, the building infrastructure coordinator. What we saw since COVID, and we're not blaming COVID, but that is an aspect of COVID, we're behind in our inspections for these units. So again, imagine 1,020 units not being inspected for 2 years. And when we inspect these units, we see what the conditions are. We can address these conditions of these units. With that delay, though, we're behind the 8 ball, and we need somebody to help with the inspections. So what we're suggesting is to hire a building infrastructure coordinator / inspector to help alleviate some of these stressors, to get in front of some of these units we could have addressed sooner than later. And maybe, Chair, I'll leave it at that as a summary for some of the Renfrew County Housing Corporation assets.
Thank you very much, Mr. Davis. I will invite Chief Nolan to continue to MC this section.
Thank you, Mr. Chair. So I'm trying to follow along with some colors on the screen for you, just so you can see the divide between the departmental contributions. So really pleased that Andrea is here to talk about homelessness, I think overall. Certainly this component, and then Andrea, if you like, I can introduce the response teams, and then we can talk about the crisis workers.
Ms. Patrick, please, welcome.
Thank you, Chair Donahue, and through you to committee. Good morning, members of Health Committee. So as you've heard from Mr. Kelly and Mr. Davis already, in looking at this slide, this is representing a number of projects that are impacting the different departments. Certainly in the community services area, we are seeing the areas of homelessness and mental health and addictions growing, and the complexities around that growing. So I will speak to the items that are specific to the Community Services Department here. Chief Nolan, so maybe the second item can be changed to blue. That's the first item I'm going to speak about, the Community Housing Coordinator. This was a position that was brought to the Renfrew County Housing Corporation Board in the late summer as a recommendation for the board to have a position dedicated to addressing the landlord and tenant board hearings for our units. As Mr. Davis spoke about, we have a number of challenges around turning over those units quickly, and one of the areas that we are seeing with our staff is during COVID, of course, when there was restrictions to the landlord's ability to file notices, L1 and N5 notices, and that was suspended. As we moved through COVID and those actions started to be able to be taken, we have a large backlog of cases in front of the landlord and tenant board. And the province has dedicated some resources to expediting some of these hearings, which is a good thing. However, for us, we need to have a staff working at that full-time to prepare the materials, present at the hearings, and try to get resolutions around these units in order to make sure that these units can be turned over, and to really work on the arrears mitigation for Renfrew County Housing Corporation. So that position was approved as a contract, as a trial by the Renfrew County Housing Board, and commenced in October. We've seen some really good progress with that position in the short time, and we are recommending that that be continued into 2024. And the other position is on the fourth line, the homelessness coordinator. This is really to be a dedicated resource to homelessness. In the Community Services Department right now, we have numerous staff who are working with individuals who are experiencing or at risk of homelessness. However, we do not have any dedicated staff resources. Our Ontario Works caseworkers who have caseloads of individuals that are in receipt of Ontario Works and determining eligibility, they also work with our homelessness prevention program, but we do not have any dedicated staff that are solely focused on the coordination of homelessness. So this position is anticipated or recommended to be a dedicated resource and to work very collaboratively with Chief Nolan's team as well as Mr. Davis with regards to coordinating the efforts that we're recommending to be put forward. And thank you, Chair. I'll leave it there.
Thank you very much. Chief Nolan, once again.
Yeah, thank you, Mr. Chair. So just to round it out, I think we can see that not only the physical infrastructure, but the supports in place to be able to support people who are precariously housed, and those that are housed within the responsibilities of the County of Renfrew are fundamental in terms of stabilizing support, care, and I think also costs. We didn't talk much about that today, Jason, in terms of the extraordinary costs related to the age of the properties that we've got, and as well by having county staff, and that whether that be a community paramedic, crisis worker, or property staff, I think the opportunity to really embrace that population is clear. One of the challenges that we have as it relates to the response team concept is that we have seen a dramatic rise in the incidence of mental health related calls across the spectrum. So we're not just talking about homelessness, we're not just talking about those in community housing or community programs, we're talking about virtually everyone in the County of Renfrew, and there are no families that are immune to the stressors in this post-pandemic period that we have. Our suicide rate is dramatically up within the county. Calls for individuals, whether it be anxiety, depression, right on through to more clinically profound mental health related disorders are significantly on the rise within the county. And we talked about it during the pandemic. We talked about what will be the consequence of these stressors, what will be the consequences of both financial pressures. We've had businesses open, we've had businesses close, we've had people not be able to support their loved ones in the way that we would have hoped. Certainly Mr. Blackmore's talked about that and the challenges of accessing. And I think it's not trying to be revisionist in our history so much as just acknowledge the fact that we have an echo associated with that experience that is affecting all of us in one way or another, but we have seen it significantly affecting the 911 utilization within the county. When we talk about that tip of that iceberg, we look at issues related to severe mental health and addictions. And we know that within the county, 8 to 10 opioid-related deaths, and every one of those is an individual, and every one of those has their own story and is a tragedy. We are perilously close to 40 opioid-related deaths this past year. So we can't ignore the fact that if that's simply the tip of the iceberg, and for every one of those deaths there have been a significant number of people that the 911 paramedics, and in some circumstances lay responders, our police officer friends, firefighters, have been able to resuscitate with Narcan. Many of those people have been fully resuscitated from cardiac arrest by paramedics, and then there are those who have not required Narcan but are living with the after effects of toxicity levels related to addictions, whether it be opioids or other substances in our community. It is absolutely at epidemic proportions as far as I'm concerned. And I don't mean to overstate that, and in fact I still believe I'm understating that, knowing that the view that paramedics have within the community, as is the case with social services and our partners in development of property, we live it, see it, breathe it every day, and there are unintended consequences both to our staff, but I think also to the way that we need to challenge our status quo as to how we lean into this population so that we can acknowledge and support what's going on. So when we look at that, we identified that this is not solely a Pembroke issue. I'd like to state that up front, and that mental health, addictions, homelessness are across our areas and our local municipalities. So we have proposed both an east and west region response team, and I could say north and south, depending on how you turn the map within the county, but suffice to say that we look at the county as a whole in this program, as we do in all programs, and that when Mr. Kelly challenged the three of us to come up with a novel and innovative way of leaning into these issues, we propose that there be community paramedic 12 hours a day, 365 days a year. So when you see the 322,000, that's not for one individual FTE. We're not paying one person that. That's what it takes to have one person on 12 hours a day, 7 days a week. In blue, the crisis worker is really the expertise of Andrea and her team. to be able to bring forward appropriate staff to be able to work shoulder to shoulder in the vehicle with the community paramedic, so that whether it be a mental health related call in the 911 system overall, whether that be us engaging vulnerable populations through a prevention lens as we do in community paramedicine to prevent them from having an overdose, using a harm reduction approach that we've heard from public health has significant benefit, and being nimble within our community so that we can prevent bad things from happening in the first place, but also have a pre-existing relationship with vulnerable populations, whether they be living in community housing, whether they be benefiting from community service programs, or they be the general population that are using these services. So there you see a salary cost, which is annualized for both the paramedic and the crisis worker, 12 hours a day, 365. You have the full vehicle cost for the program, and there's a presumption that while we need this today, there will likely be an ongoing demand for this type of program. So you could amortize that $120,000 over 5 years and bring it down if you so chose, but that would be our certainly upfront cost in the purchase of a vehicle. The capital component as well, the materials and supplies would be an annualized cost. So whereas capital could be drawn out over the length of the program or put into a 5-7 year capital replacement type program. The Pembroke share is there for each of these as consistent with certainly the contribution in terms of those shared services, but the idea being that we have a team to service half of the county with geographic relationship and the other half, and then obviously their time would be focused on where those vulnerable people are, but they would respond to 911 calls to reduce the number of people that we would take to the hospital. And Ottawa's experience with a similar program have reduced over 60% of transports to hospital from those that have mental health related issues, which is a staggering number, which reduces offload delay and other potential costs that we've talked about earlier. But it also allows us to work more collaboratively and I think in a more sophisticated way with our partners in community services, with the crisis worker. And Andrea, did you want to speak to, through you, Mr. Chair, what that role of a crisis worker could contribute, or a homelessness worker, based upon the expertise of your department?
Ms. Patrick, please.
Thank you, Chair, through you, and thank you, Chief Nolan. I think just, you've done a really good job of kind of outlining how we would work in collaboration. Certainly, from the Community Services Department lens, a lot of the individuals that we are working with have significant health challenges that are beyond our scope to deal with, which is why I think the partnership that you have in front of you would really encompass all of the needs. From the Community Services Department perspective, a crisis worker would be either a registered social worker or an addictions certified addictions treatment worker that could address the issues and then connect with our programs through the Community Services Department. Thank you.
Thank you. Concluding remarks, Chief.
Thank you, Mr. Chair. I'd look to Mr. Kelly in terms of the concepts around the funding and the twilight period of how we get going on this. I do want to anchor this back to AMO when Mr. Kelly and the warden came and said, look, we have a problem here, we need to find a solution. So in many respects, we're already many months behind the 8 ball in terms of engaging this population. Each of our 3 departments have been working closely within the resources that we have, but there is a significant opportunity here to do this. And I know that there are other conversations that Mr. Kelly would probably like to share at the provincial level.
Mr. Kelly, please.
No, thank you. And Mr. Burke will backstop me a little bit on this one, I think. So yes, I did mention we're off to Roma next week. I don't know where this will rest with the province. I may have mentioned yesterday that I believe that this too rests as a provincial issue that they should be funding, and it should not be all the taxpayer responsibility. But I'll park that there. We have at our immediate disposal some one-time relief, and again, that's in your margin. So the Safe Restart Reserve that we have, the actual wording around that, and I guess I won't give you the actual, I'll give you the paraphrased wording, is to offset any municipal pressures due to the COVID pandemic. I would suggest to you, and you've heard several times, that the pandemic has caused issues with our inspection team, getting suitable resources to renovate and otherwise to get that in there. Plus, the pandemic has been somewhat of a cause of the homelessness challenges because of rising rents and other pressures because of things that happened throughout the last 3 years. There's a community paramedic reserve. It basically speaks for itself. That's there. It was meant for other things, but has built up over the years that could be used as a relief. And we do have a cannabis reserve that is topped out at roughly $150,000. We don't see another use for this in the immediate future. It's kind of a lob ball chance that it applies to any of these as well. Although I'll wade in carefully to say that addiction and homelessness have been a result of some things. I'm not going to get into the whole is cannabis an addictive substance or not, but we do have those dollars available to us. I will state, however, that these are one-time shots. So if any or all of these are intended to be long-term solutions, the AAA, the inspection coordinator, otherwise, we can fund them for a year. We can fund them for a period of time if they're a contract position or otherwise. But these funds do run out and can run out, and then there will be subsequent pressures in future years. But we do have solutions, or can find somewhat solutions for the interim, for either the next 3 quarters or for the next 18 months or something like that. But again, those are there. Or the committee could also look at, we don't do an east and west response team. We do one central to try it out and see how that goes. There are options to consider. But again, we wanted to give you the full slate with some options. Daniel, I'm not sure if you had anything to add to these.
Thank you, Craig. Maybe just to clarify, that Safe Restart Reserve was our COVID incremental funding from the government. So that's a reserve that's restricted by provincial edict to be related to COVID costs. The Community Paramedic Reserve is an internal reserve, so you can do whatever you like with that. It was created by the County Council. It can be dispensed as you see fit. The Cannabis Reserve is like the Safe Restart Reserve. It was created when the province gave us some funding resulting from the legalization of marijuana. And like the CAO's point, the provincial reserves, the definition may not fit exactly with the things we want to spend it on, but I'm not sure that the argument is going to get better as time goes on, that things are related to COVID or to the legalization of marijuana. So maybe this is the time to accept that argument, because I don't think it's going to get any better.
Thank you. And thank you to all of the staff that participated in this. A very comprehensive report. Just one thing that seemed timely when Chief Nolan was talking about the dramatic rise that we are seeing in mental health. Of course, COVID unto itself, lockdowns, everything that was associated with COVID will have had that impact. But the other thing that I'm going to speak glowingly of, for too long, mental health existed in the shadows. And over the course of the last decade, there has been a real lean in to destigmatize mental health. And in fact, a week today is the National Day of Mental Health. We are in the month of Bell's substantial sponsorship of Let's Talk. So it can hardly surprise us that as we are destigmatizing mental health, as people now are reaching out, it cannot shock us that we are seeing the reach out from those that are suffering mental health issues. I think a large part of what we're seeing with substance use is, in fact, self-medicating with respect to mental health issues as well, in the absence of sufficient supports to attach to that. So I wanted to get that said. The other items that I wanted to, this is probably for Mr. Burke, I will leave this at your discretion, Mr. Kelly. So as I'm understanding, I think almost all committees are receiving this, or certainly those that have a direct role within this. But I believe it's housed within community services. As I note, this $2,044,000 is housed within the community service. It is right now, it is not a pressure, it is an enhancement. So I believe all of council, and I commend Mr. Kelly and Mr. Burke, I believe all of council have received now, I think, both the draft budgets and the PowerPoints from each of the other committees. So at this point, at the outset, Mr. Burke had identified, substantial efforts that went into achieving that target of 3%. But on the status quo, that's not the terminology I think that's used here, but on the status quo budgeting, i.e. for everything that we were doing in 2023 to carry forward, I think it was just under 15%. But as I understand, this is not a pressure, this is an enhancement, and I don't believe that this has been incorporated within the numbers we're looking at. And I know that the bottom line enhancements are about $2.5 million. This is $2,044,000. This unto itself is just in my calculator is 3.86 on top of anything that we're looking at. So at this point, none of the enhancements have been incorporated into the numbers. Is that correct?
Thank you, Chair. Yes, that is correct. So the lion's share of your enhancement, that extra 4% over and above our kind of baseline plan or our 3% targeted plan, is this this slide right here. And again, that $2 million, we've thrown off some offsetting revenues or reserves you can use to offset it, but we haven't incorporated that. We've put the whole $2 million into your enhancement column, and we'll leave it there for your discussion.
No, thank you. And I wanted to be certain on that point first. Certainly, there are some potential offsets, but echoing what Mr. Burke had advised, we can go to that well once at the most. In fact, there are substantially more. There's just under $2.5 million in those bullet points on the right-hand side. How much of those may be applicable, I think that is going to behoove us to be very persuasive from the elected perspective to be able to tackle this issue. But nonetheless, that well will run dry. At this point, what we're doing is putting a tarp over the hole on the roof while we are assembling all of the materials that need to be in place. So I just wanted to be certain that we understand precisely where we are, and I'm quite sure that that's going to be the conversation that will ensue next Wednesday, probably into Thursday. In any event, any questions or comments on this presentation? Councillor Murphy.
Yes, everyone, count on a Thursday, please. Don't make any appointments. So two things, Mr. Chair, if I may, to put an exclamation point on what the chief said. There is an interview with our Chief Medical Officer of Health, Dr. Morgenstern, in the Eganville Leader today, and it does, again, speak to some of these issues that we're seeing across the county. Outside of, there is a part about RSV and COVID, but mental health, drug addiction, deaths, all of it, and it's tragic. And to your point, Mr. Chair, you are correct. I think some people think that mental health is a new thing, and I will tell you, being the daughter of a Toronto police officer, it is not. But with regards to this, one of the things that Mr. Kelly brought up is going to the province. And I think that one of the things that we are very good at as a whole, as a county, is proving that we can do something and then going to the province and saying, now fund it. And I think that if we invest in this, and while we're investing in this, as we talked about, for a year, and then during that year, use all of our advocacy in our toolbox and go to the province and say, realistically, these are not property tax things. This is provincial income tax and federal income tax. So those transfer payments you get from Health Canada should be flowing down to us. I think that if we have proof of concept, it's better to go to the province with a solution than just going and saying, you know what, we had this in our heads, can we have some money? So I'm all for it. Again, I've had some time to digest it, but I think that this is a really, really, really great start to a plan to at least help with the things that we are seeing over and over and over again in our county. Thank you.
Thank you very much, Warden Emo. And I'm going to have this as the last. You may recall, committee, that we are discussing the budget of the paramedic service this morning. That may have slipped your mind in this conversation. So after this question, we will come back to the general budget so as to provide long-term care and opportunity. Warden Emo.
Thank you. And I think this is the logical place for this kind of a service to reside, because we have care of Ontario Works, housing, childcare, paramedics. We fund into the health unit, and we also have pretty good relationships with the education system and the hospitals and CMH. So it makes sense, given our investment in the supportive services that normally wrap around homelessness, that we also drive this. And I think, one of the things we can talk to the province about in the ongoing conversation is that, to put somebody in a housing ward costs $32,000 a month. To put them in a provincial jail costs $15,000 a month. Shelters are $7,500 a month, and supportive housing is $3,500 a month. So I think by demonstrating those numbers to the province, and then also by demonstrating that, this action will assist in their management of the struggles they're having at the emergency room. There's a study in Toronto where they followed 51 people who were homeless for 6 months, and it showed they made 1,500 visits to the emergency departments in the city at that time. So I think that costs money. So if we can demonstrate, and we've demonstrated with the community paramedicine across the Warden's Caucus, there's been 90,000 visits to people, whether it's virtual or in person, and that's demonstrated a savings on the drain of time. And I hate to say it that way, but the drain of time in emergency rooms, and I think this will do that as well. So the government, I think, is well placed to listen and then fund because they have a problem in healthcare, and we're able to assist them as well as serving people at the same time. So I think this makes a lot of sense, and I just wanted to put that out there, that it's a good program for a number of reasons, and money is an important factor for the province at this time, and spending it wisely. So thank you.
Thank you, Warden Emo. I think it is universally recognized, though often the political will is missing in those instances, that reactive dollars are always much, much higher than proactive dollars. Sometimes it is difficult perhaps to see where the value is, but upstream is definitely the way to be confronting these issues. Councillor Purcell. I'm lying. This is the last one.
Thank you, Chair. I think it just in regards to the funding, and I do believe that this is well needed. In terms of the substance use collective action day that happened last year, there was a request for funding that was put through to Health Canada, excuse me, in the order of $2.5 million for this particular type of investment. From what I've heard is that there's 400 applications that are being processed currently. So we're probably here in the summertime in regards to, if we were successful or not in regards to the $2.5 million. So I look forward to seeing what this entails, but maybe there's an opportunity for those people and everybody collectively to put a little bit more pressure in terms of the requirements in terms of why we need this. Some of the supporting documents were the community safety and well-being plan that we had all put together through 7 municipalities throughout Renfrew County. What were the 3 drivers? It was mental health, addiction, and homelessness. And we're seeing that in our community. So I think, we have a good foundation. We have a good, submission for that funding with Health Canada. And I'm hopeful through, the advocacy of everybody in this room that we can, get this grant in place to help us with some of this funding. Thank you.
Thank you, Councillor Purcell. Final word to you, Chief.
Yeah, thank you, Mr. Chair, and thanks to everyone who's contributed to the conversation on behalf of the people who we're talking about, and these are the people who often can't speak for themselves, and I think that that's critically important when we talk about our most vulnerable population. Thank you to Councillor Purcell and for a component of what I was going to bring up, and that is we are already collaborating with our partners across the sector and our Ontario Health team partners in the SUAP grant. So that's one lane of opportunity that should we bump this into, as Mayor Murphy describes, as let's do it and then bring everybody into that tent in terms of sharing. One of those lanes is the SUAP or the federal grant on this. Certainly Roma represents an opportunity. As well, it strikes me that if some of this was infused within budgets that have a 50-50 draw in or 100% or thereabouts draw in, there may be an opportunity to obligate the province to at least fund 50% of it in subsequent years, should we place our costs within the appropriate locations for those allocations. And then lastly, because it's not been said, our neighbors, the Algonquins, Pikwakanagan, have declared a state of health emergency, very specific to this issue. So my team has worked very closely with their leadership to replicate the elements of these response teams available to both on-reserve and off-reserve Algonquins within the Pikwakanagan community. And we are in discussions with the federal government to receive federal funding as well that could very well support these initiatives that we're talking about today. So thank you, Mr. Chair, for your time on this.
Thank you very much. And once again, thank you to all of staff that have rolled up their sleeves and done a deep dive on this. Much commendation. With that, I'm going to go back to the budget of the several segments. There is the what I call the legacy, the 911, the community paramedic, emergency service, and I've lost track. In any event, on the intrinsic emergency services budget, any questions or comments? I just wanted clarity, and I'm not sure if this is the chief or Mr. Burke. So the budget pressure identified in paramedic service located exclusively within salaries, both admin and paramedic. Is that exclusively or primarily due to the enhanced service, the additional 24-hour ambulance that is now going to be on a 12-month? Chief Nolan.
Sure, I'd be happy to start that out. Certainly, we've had to make an estimation consistent with COLA and the other formula for an increase to my overall budget for salaries and benefits, which represents about 80% of my budget. So that is the first driver. The second driver is the remainder of the commitment for the implementation of the 24 hours of service per day for paramedic coverage to realize the 911 pressures within the system. I would say those, Daniel, and happy to look to you for confirmation that those would be the lion's share of those salary and benefit. And we have the residual pressure related to WSIB that we've talked about in years previous based upon the previous actuarial report, and that's just a continuing pressure, which either this year or next, I suspect we'll be going back for a follow-up actuarial report and looking for some stabilization within those costs as well. Daniel, through you, Mr. Chair, anything to add?
Thank you. It is prescient. The PTSD component was a follow-up question, but on this one that is germane in front of us right now, Mr. Burke, can you confirm the Chief's remarks?
Yes, for sure. That is the lion's share of it. And there is one other item that was a 2023 offset revenue, which was the consumption of the remaining paramedic WSIB reserve. So that reserve is now gone. That was built into the 2023 budget to help offset some of those costs for the upstaffing. We do not have that option remaining to us in 2024. So another pressure in the 2024 budget.
Okay, thank you. And then my own follow-up then was, I do know that I believe in 2023 was the first budget where we had substantially bolstered the burden factor with respect to WSIB based on our experience and, in fact, on the actuarial reports. And if memory serves, Those are on a 3-year cycle, and I believe the last one was done at the end of 2021, so presumably at the end of this year, there will be a renewal of that process. It is certainly my hope, knock on wood, that our actuarial is going to perceive that we have made substantial gains since the last one, but I do know that we have enhanced substantially, I believe, the burden factor associated with WSIB. But unless we were using the reserve last year as an offset, the substantial increase in that burden factor was built into 2023 that I'm presuming 2024 would be largely driven by CPI basis. Is that accurate?
Thank you, Chair. So two slightly different issues, I would think. So the consumption of the WSIB reserve was just a flat, we had this reserve and we used it to offset some of the increased paramedic hours or costs in paramedic service. The WSIB actual cost, so you are correct that the last time we had an actuarial evaluation was 2021, well, for the year end 2021, 22, and 23. So in 2024, we are going back to the consultant. It's on my work plan to set that up sometime mid-2024, and we'll see how we've done with the measures we put in place. I wouldn't presume to know the actuarial calculations or wouldn't like to give you a guess of where I think we're heading. For the 2023 year, we did substantially increase the WSIB, what we'd call a burden factor, up to about 15%. 15% of gross wages is being funneled into our, we'll say, WSIB liability account, and then we use that liability account to pay the actual invoice WSIB incurs, and they charge us. I can say that 15% is the correct level of burden for the 2023 year. We do not have a substantial year-end adjustment required. So we have reached the correct level of burden for our plan, which was set 3 years ago, and this is the last year of that plan.
Okay, and so ultimately then, going into 2024, with respect to the WSIB and all of those questions surrounding that unto itself should not be inflationary if in fact we have seemingly targeted the appropriate burden factor. There is not an anticipation of having to escalate the burden factor itself.
That is correct. So the 2024 estimates assume that 15% burden factor that's working will be carried forward into 24.
Excellent, got it. Thank you. Any further questions so I've started with the general, the 911. Any further questions, comments? I see none. Moving on to paramedic other. I see none. Any questions on emergency management? Once again, I see none. So if you recall, there was a resolution to forward this budget to the budget workshop next week. It has been moved and seconded. In the absence of any further questions or comments, all in favor? That is carried. Thank you. I do know that we are certainly under some time constraint, but I think probably everyone could use a brief break. Oh, sorry. Since we have now concluded the emergency services report, I would now seek a motion to accept the report as a whole. Warden Emo, seconded by Councillor Purcell. All in favor? That is carried. Thank you. And it is 11:24. At 11:34 sharp on that clock, we will resume. Mr. Hill. Welcome back, everyone, and thank you for your diligence in returning. We still have the long-term care budgets to review. Just bear with me. I'm going to have to get back to the resolution. You will find that on page 44 of this morning's PDF. I would invite Mr. Blackmore, if you would be so kind as to read the resolution.
Thank you, Chair. Through to committee. Recommendation that the Health Committee recommends that the draft 2024 Bonnechere Manor and Membership Lodge budgets be forwarded to the January 24, 2024 budget workshop as presented.
Thank you. I would seek a mover, please. Councillor Weir, seconded by Warden Emo. And Mr. Blackmore, I will yield the floor if you wish to take us through, and I'm assuming you will share said duties with Mr. Quad as well.
Yes, Chair Donnie, if you could just bear with me 1 second while I set up here.
I think, so there is the PowerPoint presentation, and I believe all of committee has that. In addition to that, the budget itself for long-term care begins on the agenda on page 66 and then jumps to get past to the emergency services. That is a public service announcement.
There, it worked.
Okay, looks like I'm ready to roll. So through you, Chair Daniel, we're not going to do the honors this time. Basically, it's a repeat of what you've heard earlier. So I've got a number of slides I have to skip through, I suppose, here. Tell me when, Daniel. Okay, so just a reminder, as we discussed earlier, we discussed the 3 levels of budget pressures. Levels 1 being those we could do, without significant impact. 2 with minimal service level disruptions, and 3 with a significant level of service reduction. And just getting into my budget, I'll tell you in advance that we're proposing 2 level 1 reductions. Now I can't see this. Okay, so the first slide gives a municipal funding budgetary overview for each of the health community departments, including budget enhancements contained within the first column, for which there are none proposed for Membership Lodge or Bonnechere Manor. Yeah, I'll skip that. The second slide, so as committee will recall, unique to the homes is a cost share agreement with the City of Pembroke for long-term care services. The aforementioned cost pressures required to maintain a status quo budget represent the county portion inclusive of recoveries from the City of Pembroke. And I should just add, I've put a page number up in the top left corner to correspond with your package. This page is page 66 in your package. Next is it's just a reiteration of how we arrive at that cost share agreement with the City of Pembroke. So it's bylaw 134-21, where cost shared is based on a 10-year rolling average of the resident census as of December 31. And the residency is determined by the municipality that in the 10-year period prior to admission the resident had resided in. Currently running at about 2/3 County of Renfrew and 1/3 City of Pembroke for the homes. Just before getting into the details of the budget, the business plan starts on page 56 of your package. And just to overview it briefly, I want to identify some of the priority projects. Happy to announce that these projects are of nominal, if any, cost. So first, we're looking at enhancements to our recruitment and retention strategies. So we want to continue to develop and implement comprehensive recruitment and retention strategies. We want to continue to facilitate on-site training opportunities for our health sciences students at Algonquin College and University of Ottawa and other universities as well. But we have clinical placements, preceptorships, potential revival of our PSW living classroom at either of our homes. And at present, we're engaging in a preceptorship program funded by the province to help provide funds for training for our preceptors, as well as backfill. The next priority for us is the County of Renfrew Long-Term Care Home Strategic Plan. This is something we've engaged in, well, since I can remember, at least for the last 20 years. A 5-year plan for the homes, just laying out where we want to be in terms of strategic priorities. So we'll be continuing with that. It's part of the Fixing Long-Term Care Act now. So as part of that, we'll be engaging all of our important stakeholders. We want to an initiative for the First Nations, Inuit, Métis, Urban Indigenous, and Equity, Inclusion, Diversity, and Anti-Racism enhancement in partnership with Ontario Health. We want to facilitate education with our staff in this regard. Our Bottom model of care, as I'm sure committee is well aware of, we're poised to complete certification for Miramichi Lodge this coming February. We're adopting what's called the Crystals program for Monastery Manor. So it's a continuation, just maintaining our readiness for certification for that time when we are able to replace some of our agency staff with more permanent staff to allow the training to come to fruition so we can certify Monastery Manor as well. And we want to promote our homes, policies, and procedures, consistency, and alignment. So just, it's been a theme for the past probably 5-6 years now, where with the advent of the Director of Long-Term Care position, facilitating a more like policy procedure among both homes. First, this next slide just gives you basically an overview of where the Miramichi Lodge and Monastery Manor sit in terms of percentage of the overall municipal budget at 3% each. Just keeping in mind that 3% each, but in terms of that 3% represents 10% of the home's operating budget. Our next chart identifies expenditures, and to no one's surprise, the majority of our expenditures are wages, 79%. Utilities to 8% being the next, and you can, for the purpose of time, you can continue on with that. Just wanted to add that in terms of wages, wages and benefits being the majority of the cost, and that stands to reason with basically 53% of County of Renfrew staff work at either one of the homes. So essentially 1 out of every 2 staff, a little more. The next graph depicts the various, the revenue rather. So the greater majority of our revenue is derived from the province, 65%, followed by resident revenues, the rates paid by residents to reside in the home, and 10% being the municipal subsidy. And transfers from reserves at 4%. This slide here is the result of a very recent development. I'm talking within the last week. So committee will be maybe aware of what's called the nursing supplemental funding. So that's the RPN, PSW, RN funding that was floated to us from the province with the intent of homes across the province achieving the 4 hours of resident care per resident per day. Over the last late 2022, our approach to utilizing this fund was that of not being able to utilize it unless we were able to demonstrate an increase to our base staffing from 21 forward, supported by our auditors. So anyway, we tested this with the conversation with the province, with our auditors in tow, and we're advised by the province that yes, indeed, we are entitled to use those funds for purposes of retention, not only for building upon our base. So it's great news for us in that we get to retain $2,598,340.65 that was held back for 2022 and a portion of 2021. And as a result of that, as Mr. Burke, I'm sure, will attest, having recently completed our 2022 ARR, we'll be having to revisit that entire procedure, revising it once again, but again, to our betterment. And I should add that the budget that lies ahead of you is based on this, is predicated on this knowledge. So the first slide is starting with Bonnechere Manor's decline programs department. Again, starts on page 69 of your report. And just briefly, as I'd mentioned earlier, as a whole, this budget is pretty much a status quo with the exception of those green items we'll get into within the nursing department. So yeah, this department has 3 full-time non-union staff at 19,000 hours of CUPE staff, 1 physiotherapist, a social worker, which are funded by Allied Health, and just can keep in building this budget in mind with the fact that we have a 3.25% increase this year for 2024 rather for CUPE. Next is the Bonnechere Manor Nursing Department, and I just boxed in red at the top. This is where we're proposed to achieve our most significant saving in that green level 1. So that's a budget pressure totaling $619,822. And the next slide gets into how that pans out. So just a general summary for the nursing department. We have 4 full-time non-union staff, including 1 new position for a clinical resource. That's going to be funded by 100% funded by Allied Health funding. 6,000 hours of CUPE staff. Nursing direct, we have 232,000 CUPE PSW hours, and 73,000 that are funded by this supplemental funding fund that I had mentioned earlier, of which approximately 38,000 hours of that is currently staffed, and 35,000 hours is currently vacant. And that just goes to demonstrate, it goes to the challenges that all homes and healthcare alike are facing right now with regard to recruitment. In addition, we have 18,000 ONA RN hours, 43,000 CUPE RPN hours, 1 nurse practitioner, 1 infection prevention and control RN, and 1 RI MDS coordinator. And unique to the Manor, we also have $700,000 rather in purchase services for agency nurse costs. That's agency enhanced and agency hourly wages, travel, and accommodations makes up that cost. Provincial funding specific to this department is high intensity care needs, for which we are eligible for 95% recoveries, lab fee subsidies, a physician on-call subsidy, and our nurse practitioner funding, which we utilize for our full-time RN. We also top that up with Allied Health funding as well at no cost to the county. So as I had alluded to earlier, the first level 1 reduction rather, is to reduce that PSW hours budgeted by 15,000 hours. And keep in mind that these are PSW hours that are currently vacant. Actually, there, as I mentioned earlier, there are 35,000 hours vacant. So to reduce that by 15,000 still leaves 20,000 to fill. And on top of that, there's still agency staff that we need to replace with permanent staff. So we still have plenty of room to recruit going through this upcoming year. Next slide is Bonnechere Manor Food, and just an overview. 3 full-time non-union staff, including a dietitian. 39,000 CUPE hours for cooks, chefs, food service workers. We share an assistant food services supervisor with Miramichi Lodge, and recoveries for food used in the adult day program, which is a separate program unique to Bonnechere Manor. And we also have vending machine sales as part of that. Housekeeping, 28,500 CUPE hours for housekeeping aides, and we do have recoveries in that department as well to cover day program hours spent. Laundry, 12,300 CUPE hours for laundry and clothing aides, and we have, again, more recoveries for time spent in adult day program. supplies, rather. Bonnechere Manor Building, we have one full-time non-union manager, 8,300 QP hours for electrician, plumber, and maintenance. Recoveries for the day program area maintenance, as well as phone and internet charges to residents. We have $204,992 that is budgeted to maximize a new minor capital funding, and we have until March 31 to spend that. That's 100% ministry funding, and we're looking at prioritizing our spends for that fund. Health Committee, Bonnechere Manor Administration. Just one note there, an anomaly may you pick out is travels increased, what's it decrease, sorry. Page 73. It's a increase, and part of that, there was $3,000 previously charged to the Miramichi Lodge travel budget for Director of Long-Term Care Services that's been transferred over. In addition to that, we have a Human Resources Coordinator that we now share between both homes, and an Administration Supervisor that we share between both homes. At an overall cost savings, where there was once 2 Administration Supervisors, now we have an Administration Supervisor with financial expertise to share between both homes, and an HRC with HR expertise to share between both homes. Bonnechere Manor Administration, so we have 5 full-time non-union staff, 2,000 QP hours for receptionist. We do have recoveries there as well for the adult day program. And for the ML for admin assistant, again, that shared position. Internal charges, admin finance, HR, IT, ML, all services from county corporate that for those services provided to the homes. In addition, we have recoveries from our purchasing consortium rebates. So we belong to Complete Purchasing. We make a great majority of our purchases through that, and at the end of the year, we receive substantial rebate checks for both homes. Bonnechere Manor Capital. So just the number of items we have set for 2024. Flooring, tub replacements, hot water heaters at $225,000, a garbage compactor, our solar panel inverter to keep our solar panels in service. That's a revenue generator for the manor. Sprinkler replacements, emergency power generator replacement, as you can see is a significant cost of $500,000. And ongoing butterfly dementia care unit renovations. So that's largely to do with sensory-scapes and things to make the butterfly unit more home-like. Revenues for Bonnechere Manor. So we see an uptake in preferred accommodation tied to the loosening of COVID restrictions. We also receive funding from the solar panels as well. Continue with funding. Provincial subsidy, we have a PSW premium, 100% funding to increase the PSW wages by 3 hours with no maximum cap. We have allied health professional supplement, 100% funding to increase staffing hours in certain classifications, majority of which are health professionals, allocated at $339,436. Nursing staff supplement, I alluded to earlier, it's 100% funding to increase or, most importantly, sustain staff levels in direct care positions. That's nurses and PSWs at a maximum allocation of $3,100,334. Funding again, so our operating subsidy estimated at $9,500,697 is made up of 14 components. As you're all aware, long-term care is quite intricate with a number of funding envelopes. The largest of which being our CMI, so that's our case mix index, and this committee is probably well familiar with the case mix index. That's funding that's determined based on the acuity level of your residents from the year past. There's some discrepancy with regard to its accuracy and its timeliness. As the committee will recall, I was fortunate to have attended as a member of the technical advisory group at the behest of CEO Kelly and the warden, and certainly Mayor Donahue, you were present at the AMO conference. We've had our meetings. It remains to be seen what's going to be coming forth in terms of improvements as far as CMI is concerned, but here's hoping it's for the better. $375,000 in other funding not tied to beds or days. It's reduced by revenues collected for resident revenues collected. Funding is on a provincial fiscal year, however, early planning tools. So we count on an increase annually from the province, a global increase in terms of acuity. And basically, we're predicting a 2% in that realm. And as I'd mentioned earlier, CMI being one of the more important facets of our funding formula, it happens to be on the decline. I won't say it's on decline in terms of the resident acuity, but rather in comparison to the resident acuity average across the province. Miramichi Lodge. I don't know if we want to stop at Bonacher Manor or just plow through both homes.
Unless there's anything pressing, I think it's probably of value to move through both homes. However, if there's anything that's been identified at the manor that you wish to bring forward, committee, at this point, now is your chance. Okay, let's keep going then, please.
Great. So again, started decline programs, similar setup. Again, the significant factor here being that 3.25% increase slated for CUPE. A little bit different at the client programs at Miramichi Lodge versus the manor is the fact that we have purchased services physiotherapy versus staff physiotherapist. Nursing. So again, this is basically level 1 green, number 2. It's similar to the manor. Our most significant portion for reduction is that of the nursing direct care. The deficit being $967,568 to achieve full budget potential in terms of what the province floating to us. And I'll overview that in the next slide. So similar to the manor, 4 full-time non-union staff in nursing admin. And we're slated 1 new position for a clinical resource to be funded by Allied Health. 227,000 CUPE hours at base. We have 84,000 that are funded by the supplement to get to 4 hours of care. 52,000 hours of CUPE RPN, 14,000 ONA RN hours. And just for awareness, our ONA agreement is set to expire March 31st, and we're engaging in our first talks coming up in early February. We have 1 nurse practitioner, an IPAC RN, or IMDS coordinator. Similar envelopes to Bonacher Manor with slightly different dollar amounts. And I'll skip down to level 1. Level 1 reduction, PSW enhanced hours. Reduced by 24,000 hours, and I want to emphasize these are currently vacant hours, no impact to existing staff. And suffice to say that the $84,000 mentioned earlier in direct care that are funded by supplemental funding, Miramichi Lodge is currently staffing 12,000 of those hours, leaving 72,000 vacant hours. And when you take the 24,000 hours proposed out, that still leaves 48,000 hours of vacant hours. It's approximately 23 full-time equivalents. Still left room to staff. Miramichi Lodge food, similar to Bonacher Manor in terms of setup. A little bit of difference that we do have a cafe we operate at Miramichi Lodge, Cafe M. It's just as it says, it's a cafe enjoyed by residents, family, and staff alike, and it is a revenue generator for us. Our housekeeping, 26,500 CUPE hours for housekeeping aides. Laundry, 8,000 CUPE hours for laundry aides. The building, 1 full-time non-union manager, 6,400 CUPE hours for maintenance. We do have recoveries. We have our phone and internet phone services to residents. There's not internet at this time. It's phone and cable. We have 102,000, 292,000 to maximize our new minor capital. And again, we have till March 31 to expend that, and that's 100% funded by the ministry. Nursing admin on page 80 of your report. I'll skip to the bullets. We have 5 full-time non-union staff. And we have recoveries for time I spend 1 day a week at Bonacher Manor. Same internal charges as the Manor in terms of corporate services. We do have a large increase in computer costs for the replacement of 38 computers and 7 network switches that are due. And again, we enjoy those same rebate from our purchasing consortium. Capital items for Miramichi Lodge, flooring at $70,000, a chiller at $35,000, air conditioning, studying and controls at $61,500 for our HVAC system, some site work, paving and ditching, variable air valves, $20,000, hydronic distribution, parts replacements, nurse call system at $315,000, emergency generator transfer switch, and again, continuation with Butterfly Dementia Care renovations on the unit. Miramichi Lodge revenues, so similar to Bonacher Manor. We have PSW premium. That's the same allied health supplements and the same nursing staff supplement I aforementioned. That maximum allocation of $3,049,000 $3,049,401. Tongue twister. So Miramichi Lodge's operating subsidy is estimated at $8,926,103. It's made up of the same 14 components. Basically a $200 per day per diem, of which $105 is adjusted by CMI. $350,000 in other funding. Again, we're counting that same 2% acuity increase. And Miramichi Lodge CMI saw a drop as well. That realized a significant drop in revenue. But again, the acuity level home compared to the home lodge compared to itself the previous year was not a significant drop. Okay. And Mr. Burke's going to take it from here.
Yeah, just as a reminder to this committee, we do have 21 other long-term care beds that were transferred to the North Renfrew long-term care home, along with the funding that goes with them. So that is an old agreement from 2001. So that's what falls out under the other long-term care envelope. And if we could get the next slide. The other area, I guess we've called it the health unit, but we've also bolted on a proposed enhancement that has nothing to do with the health unit. So we'll start calling it health other, I think, from now on. But we do have a funding letter from the health unit. It envisions a 10% increase from last year's funding letter. So we have built that into your budget. The other component, the enhancement, is a request from the Pembroke Regional Hospital. I do believe that they presented to Health Committee last month, and they are asking for some support for their electronic medical record. So we have thrown in the number that they would like us to support them to the tune of an annual number. I'm not sure if the CAO wants to add a comment on that one.
Thanks, Mr. Burke. So yeah, you'll recall PRH came to this committee, or came to
Council in
Council.
November.
Thank you. It's all a blur. Came last year and was suggesting that their medical records, medical record sharing program, electronic medical records, was north of 17 million or something like that dollars. And looking for support. Other municipalities in our research, other counties, upper tiers, have contributed up to about $1 million over the course of 5 to 10 years. So again, we didn't land on anything anywhere here. Staff hasn't committed to anything other than to bring it forward as an idea or concept for this council to consider.
Next slide.
And there's one more assuming Mr. Burke, you will be addressing that as well?
Yes, so the final component of what we'll call the other health committee items is, of course, the Ottawa Valley Ontario Health Team, which the CAO brought forward a couple bylaws for you to agree to this morning. Again, it's a zero cost to the county. It essentially, we operate as the fund holder, and we are dispersing the funds at the direction of the steering committee. So it's a net zero, but it is about $1 million a year flowing through the county in and out. And with that, that concludes the long-term care section.
And other. With that, then, committee, any questions or comments? And we'll begin with the long-term care. Once again, with respect to either now, Bonnechere Manor or Miramichi Lodge, they do largely mirror each other. Questions or comments? I think that there is some value in underscoring what Mr. Blackmore had been advising in those cost pressure columns, particularly I think with nursing services. What you were seeing in the proposed reduction of hours is reflective of the incredible challenge, not just long-term care, but health human resources broadly right across the health sector. Perhaps felt most acutely within long-term care, but that is underscoring what has been suggested as those level 1 adjustments that could bring, not specifically the health committee, but holistically the county of Renfrew towards that 3% target. Ultimately, what those are doing in the 2024 draft budget is it is now incorporating the most recent information as to the eligibility for that supplemental funding. Health Committee probably will recall through 2023, I often likened it to the child looking through the outdoor candy store window when we had that funding for both Miramichi Lodge and Bonnechere Manor. And yet, under our initial interpretation of eligibility, we could not access that. And again, the challenge was recruitment. This is still at its initial rollout was towards this recognition of the appropriateness of the 4 hours of care. We are slowly moving across that on a provincial basis. In any event, so it has been in court. Now the revised eligibility has been revised and has been incorporated into the 2024 budgeting. There is still, and I would invite Mr. Burke perhaps to shed a little bit more light or provide some clarity. Mr. Blackmore did have a slide on the supplemental funding. There was a pretty substantial number in there, something north of $2.5 million. So, and please correct me if I'm wrong, in our interpretation of the eligibility, presumably we were using levy dollars, both ours and the city of Pembroke's. It has come to our attention, I believe, that some of those, a lot of those costs could be contained within that supplemental funding, which in my understanding would then displace the municipal levy dollars. And on, in fact, I think I took a snapshot of that page. Yeah, just under 2.6 million. The bullet point, as a result of County Renfrew long-term care homes have confirmed entitlement to utilize 2.598 million held in 2022. I wonder if you could speak, provide a little bit more clarity. That ultimately, I'm assuming, is not going to get reflected at any budgeting, but is going to have an impact perhaps on surplus that was recognized in 2022 or potentially in 2023.
Yeah, happy to do that. Thank you, Chair. So if we can go back to the beginning of this story, in late 2021, there was a new 4 hour of care per day funding announced, and it was quite substantial. The funding requirements, and the funding requirements still say that the funding is to be spent to increase hours of care. And that was our hang up. It was the opinion of your former treasurer, your current acting treasurer, your former auditors, and your current auditors that we had to increase the actual hours of care in order to be able to access this funding, which has been our struggle. We are somewhat up in hours over the baseline we chose of 2020, but not to the extent that we're funded. And that is the position taken across the province. So far as we're aware, all other homes are more or less in the same boat, struggling with this. Beginning, I would say about a month ago, we started asking, Mr. Blackmore started asking questions about, well, our costs are up, but our hours are not. How do we keep this money? And the answer from the ministry was, don't worry about it, just keep the money, which was a rather shocking answer.
Presuming colloquially, I've never heard any bureaucrat ever use those terms because those are far too understandable.
Yes. So we've been back and forth a few times because, again, this is a provincial-wide issue. So last Thursday, we had our meeting with a partner from KPMG who does numerous long-term care homes, not our audit partner, one of our audit seniors, myself, the CAO, and Mr. Blackmore, and the ministry director in charge of this funding, and had that message reiterated again. We're still expecting the reply in writing, which has been promised to us, so that's our holdup. When we get that reply in writing, it effectively turns this funding into flat funding as opposed to a subsidy calculation that we have to earn. Now we can just keep the money to the extent that we have frontline costs, which we definitely do have frontline costs. So what this means is that the 2021 funding and 2022, which those year ends are closed and audited, will have to be revised to about $2.6 million. What that means is we will have to, early days discussion with the auditor, we will have to probably reissue our 2022 financial statements. So that is something that has not happened in the history of County of Renfrew. I checked, but within 1 month of me being treasurer, I've succeeded, so thank you.
To be clear, though, they are in the favor of the county,
yes,
not the opposite, or this would be a different discussion, Mr. Burke.
Yes, that is correct. So that is the history. Now the 2023 year, which we are working on, if you go back to the last set of financial statements you would have saw in September for the first 3 quarters of the year, they would have been short $2,900,000 for Bonnechere Manor and $2,600,000 for Miramichi Lodge, under the assumption that we hadn't upstaffed enough to keep that funding. So a substantial change to the year-to-date financial statements. And also now in the 2024 budget, we presume that we can keep that funding in its entirety whilst not having to spend it dollar for dollar on staff. Otherwise, in your 2024 budget, you couldn't achieve any savings through staff reductions because you would also have to give up the funding attached to it. But now, as soon as I get that letter from the ministry, we will begin this process, which is a very good news story.
Absolutely, and I thank you, Mr. Burke, and of course, Mr. Kelly, and the tenacious Mr. Blackmore. This is substantial good news that it has been divorced from the very specifics of the additional hours, where, and I'm not even sure that I believe that it may even surpass that, because unfortunately, the other comment and the last one that I will make on the budgeting generally, CMI has become completely divorced for what that was intended for. We knew that when we had our delegation, Mr. Kelly, as you recall, Mr. Warden, at AMO in London. It was very timely, and Mr. Blackmore was invited to participate in a task group to identify this. The CMI was intended to recognize the dramatically increasing acuity of residents on intake into long-term care. The challenge is that it has not kept pace, and I don't know if the fund has actually increased, but it is ultimately relative, i.e., our acuity, I think, if I understood Mr. Blackmore correctly, at Miramichi Lodge, it may be down slightly, but only slightly, but it is not down commensurate with the decrease in the funding for CMI. In fact, we have experienced here, perhaps in both homes, but I know where we have seen an increase in the acuity, but it is not being kept pace with in the funding for the acuity. ultimately what that is suggesting is that is the envelope that the province is funding, and your individual home's funding is going to be on a ratio or on an indexed basis, i.e., if your acuity may be up 1%, but you are below the average of the increase of acuity across the province, you're probably going to see your funding reduced. I cannot conceive of a better notion of divorcing the funding envelope from what it is actually intended to do, so kudos to whoever designed that particular funding model. In any event, that's still, and I'm very thankful that Mr. Blackmore is participating in that review, and hopefully we are going to come up with something that does recognize the true increase in resources required to residents in long-term care. But at the very least, if nothing else, and I believe it is much more than else, that this is perhaps going to soften the blow from the reduction in the CMI funding. That is my entire piece. So once again, back to committee for any questions, again, on either of the long-term care budgets. With that, then, I think that the other budgets are not part of Mr. Blackmore. So I believe, Mr. Kelly, I would now be seeking a motion to accept the long-term care report.
That is the motion on the table, sir.
Okay. So the motion, sorry, I guess the budget is now on the table. I don't think I called the vote on the budget, except advancing the budget to the budget workshop. So I will now call that question. All in favor? That is carried. Thank you. And with that now, the housekeeping of I'd seek a resolution to accept the long-term care report as a whole. Councillor Murphy, seconded by Councillor Weir. All in favor? That is carried. I'm not sure where these other ones are now contained. Maybe they were within the administration. Are there any questions on either other long-term care or the health unit or the Ontario Health Team? I see none, but I'm at somewhat of a loss to know how these are advancing.
Chair, the committee is informed of these issues. They will advance to the budget workshop anyway, so they're not really under the purview of your acceptance of or approval therein. So they're just they'll form part of next week's budget workshop in any case.
They will just naturally flow through to the budget workshop. We are not required to take action whatsoever.
Magic,
Thank
sir.
you.
Thank you.
Once again, by edict of the tyrant-in-chief. We do have a Board of Health minutes from, I believe, October. Can I seek a motion to receive, I think, those? Councillor Purcell, seconded by Councillor Wilmer. Any questions or comments? None. All in favor? That is carried. Thank you. Is there any new business? Praise God, there is not. Oh, there is. Wonderful. Councillor Murphy.
Sorry, there is one. I have one item. Unless you have an item. You go. All right. Well.
Mr. Kelly.
Please go, because the chief isn't here and it was germane to the paramedic service. I guess I'm waiting for county council.
Mr. Kelly.
Thank you very much, Chair, and sorry for the late notice. So I've been informed by a committee member, Councillor Yan, who has unexpectedly needed some family time for the next 3 months, and she has provided written notice for a request of a leave of absence from committee and council. As per procedural bylaw 73D, I believe it is, she has again provided written notice, and by resolution I would ask that you consider that request for a leave of absence up to 3 months or until her return.
I'm just questioning if I'm not sure if the committee has, I believe it would be council that would have the authority to grant a leave of absence. Do we need to have a recommendation, or would that just come straight to council? I thank you for the notice nonetheless.
Yeah, no, if I could just read a snippet from procedural bylaw 73, item D. Should any member of committee fail to attend 3 successive regular or special meetings without being authorized to do so by a resolution of the committee may certify such failure, and the membership of such person on the committee is terminated. council may appoint another member in his or her place. Receipt of a written notice of regret by the committee or council will constitute authorization for the purposes of the subsection. So authorization does rest at committee and council.
That is clear. This is a two-step process. Each of those bodies must grant the leave of absence unto themselves. Having said that, could I seek a motion, please, to grant leave of absence to Councillor Yon? Moved by Councillor Murphy, seconded by Warden Emo. All in favor? Of course you are. That is carried. Thank you. I believe, Councillor Murphy, you may have had new business.
How kind of you to rejoin. I'm not going to divulge too many details, but my husband did have a very serious health emergency at 4:30 in the morning on Boxing Day. And Chief Nolan, I know you and I have been texting, and Chief Nolan texted me before I even got to the hospital. So I just want to thank you, Steve Osipenko, and the 2 paramedics and the 2 ACPs that were at my house, and the amazing care that they took of my husband, and just a huge thank you.
Thank you very much for that, Councillor Murphy. I'm sure that is well received by the paramedics, and please do extend that to Chief Nolan. Any further new business? I see none. So we do have a closed meeting. I would now seek a resolution to move into a closed meeting pursuant to Section 239 of the Municipal Act 2001 as amended for the purposes of labor relations or employee negotiations. Councillor Wilmer, seconded by Councillor Grills. All in favor? That is carried. I will allow a moment for all those to vacate that are not required to be present at this. Thank you, everyone, for your patience and maybe watching this live or in the stream, actually, or in the recording after the fact. We are at item number 12, the date of the next meeting. It shall be Wednesday, February 14th, 2024, Valentine's Day. Oh, joy. I would accept now a motion to adjourn, please. Councillor Wilmer, seconded by Councillor Purcell. All in favor? That is carried. Thank you very much for your diligence. This was a lengthy meeting. Most appreciate your concentration and attention to detail. Thank you.